Hello, good evening, everybody. Welcome to our Tuesday evening. Looks like everybody's suffering from various degrees of coolness around the country at the moment. We've had summer, now we're into winter, and hopefully we'll have spring again tomorrow and back in summer again. So seasons are very, very confuzzled at the moment. But we've been covering on our Technical Tuesday, we've been covering the subject of ADD and ADHD, and I'm incorporating into that autism because it seems to be something that's quite prevalent these days. Whether we're just more aware of it or whether it is more of an issue, I don't know. But autism seems to be quite an enigma, and they talk about a spectrum. So there's actually varying degrees of it. And some people are affected more than others, but it can affect a lot of people. It's not a disability, it's other ability. I really dislike the word disability. And it would be no different to saying somebody who's got high blood pressure is disabled, or somebody who's got diabetes is disabled. They're autistic on a spectrum, and that's a whole big, broad area that I'm not even going to attempt to get into, but I'm just going to cover a very brief outline as to what it is. The information I'm using tonight has come from Dr. Jim McAfee, from one of his newsletters, and I think he covers it quite nicely. So let me just get my goodies going over here. And hide this. And hide this. So we've gone over the past few weeks, ADD, ADHD, and I don't know if we've come to the conclusion yet if it's an advantage or disadvantage. And I think it really depends on the individual person and how they look at it. Tonight we're going to cover autism. And as I said, this comes from Dr. Jim McAfee, who's a highly esteemed clinical nutritionist. So while this isn't ADD or ADHD, in my opinion, it falls in a similar category, as it seems to be significantly more prominent these days than in the past. There are complex medical criteria for the diagnosis of autism. So it's not something that just anybody can diagnose. The condition is basically, it's an abnormal response to everyday stimuli. Thus, a child might not respond when their name is called or have an abnormally high pain threshold. And it's not just they're so focused on TV that they're ignoring you. They can be staring into space, and you call them, and it's like they're on a different planet, they're in a different universe. Or they can touch a hot surface and they don't flinch because they just don't feel the pain. Autistic children develop repetitive behavior, such as moving arms or flapping of the arms. And this is, in my opinion, where it can get confused with ADD or ADHD, more specifically the HD. I remember a previous boss of mine, his son was diagnosed as autistic. And one of the ways that they picked this up was that he would have an absolute meltdown if it was made to sit on a different side of the car when they were traveling. So he always sat on one side of the vehicle, say the left side, in the back seat. And if they tried to change him into the right seat, he would have a complete meltdown. And that's just one of the little anomalies that these kids have got. They often become obsessive, compulsive, and anxious. So, do you know anybody with these conditions? Autism is characterized by regression, not progression. So they've hit a certain spot, and now it looks as though they're going backwards, which is quite troubling. The child may lose a particular skill, such as the ability to speak or demonstrate loss of vocabulary. Sometimes I wonder if my 13-year-old has got the same problem, because she'll start to speak and then she trips over her words and goes, and she really has difficulty figuring out what she wants to say. It can be quite amusing at times. A second form of regression is the failure to develop skills peers demonstrate at the same age. So you've got to look at a broad spectrum. So take a class of 6 or 7-year-olds, I suppose, and you see how each one reacts. If you pop a balloon and they all jump, well, pretty much everybody's normal. Or if you make a loud bang on the desk and everybody jumps except one, you need to check that one, because they're different to their peers. So maybe one of them is a maths whiz as well. You see these kids and you give them a long, complex series of numbers, and they look at the board and they look at it and they give you an answer, because it can be plus, divide, multiplication, square root, solve, bag, shoot. And they look at you and they give you an answer instantly. If anybody has ever watched the movie Rain Man, you will understand. And it was Tom Cruise and I can't think of the other guy's name, but Rain Man was a movie about an autistic child, or an autistic adult, in fact. And it was played and portrayed brilliantly. So if you want to get an idea of what autism is like, do yourself a favor, go and look for that movie. It's an old movie, and watch it. And you'll get a pretty good idea. The cause of autism is hotly debated within the medical community. In other words, they don't really know what's causing it. Some say this causes it, some say that causes it, but they can't really pinpoint an exact thing. This talk will assume that there are multiple causes of autism which result in a toxic overload on the body of a child. So they may have been exposed to a toxin of some sort. It could be something that they ate. It could be something that they inhaled. It could be something that they touched, maybe. You never know. It could even be something in the air. But it was a toxic overload, so too much for their system to be able to handle. Each of these causes can be considered an associated condition which can be addressed apart from the overall diagnosis of autism. The toxicity associated with autism can result from too great of an exposure to toxins on the part of a child, or a weakness of a child's immune system, resulting in an incapacity to deal with a toxic load, which might not be a problem for a child with a better functioning immune system. Same with adults. Everybody's different. Why do some people catch a cold? Somebody walks down the street over there and they sneeze, and suddenly you've got a cold. And you get better, but it takes about a month. And 3 days later, somebody else sneezes on the opposite side of the street and you get a cold. Whereas others can be exposed to this all the time and absolutely nothing happens. We saw a good example of this in the pandemic recently, where some people died, some didn't. Some had symptoms, some had none. Everybody's immune system is different. Addressing concurrent conditions in autism often results in dramatic improvement in the underlying condition. And I'll come back to saying once again, find the cause of a problem and you will generally be able to fix the problem. Comorbid conditions, in other words, similar conditions, which often accompany autism, can include things like infections, food intolerance and allergies, or you're allergic to certain foods, exposure to toxins, and dysbiosis or presence of toxic organisms in the digestive tract. Dr. Jerry Cartzenell, who's a medical doctor, likens the immune system to a garbage can. How's that for a thought? There is no problem as long as the garbage created fits in the can. On the other hand, when overload takes place, garbage begins accumulating outside the can, drawing flies, rats, mice, and in our case, monkeys. Decreasing the load can thus often reduce symptomology associated with autism and similar disorders. So take the trash can again. If there's more trash around the can than there is in the can, you're going to have all these pests. Pick it up, put it in a plastic bag, put it in the can, seal the can. What happens to all the pests? They hang around briefly and then they disappear because they're looking for the next easy meal. And the same thing happens with autism. So the toxins that some of the toxins that they've picked up that can lead to this. Mercury, which is a potent neurotoxin. Now, we do have a little bit less exposure these days because people are more aware of this. So you won't find mercury quite so often. Mercury is still used in dental fillings and is present in large ocean fish like tuna. So it is still around, quite often in trace elements. Now, dental fillings, fortunately, they have picked up on this, and you will find that current dental fillings are all an amalgam. They are no longer mercury. And people who have had mercury in their fillings will often be recalled, and they will have that filling removed carefully and redone using a different material. An evaluation of the aluminium adjuvant issue found that low doses of aluminium were more toxic than larger doses, and they concluded the following. Aluminium, or aluminum as the Americans like to say, and mercury are only two of a host of additives commonly found in preventative treatments. I am using different terminology because people are still very, very sensitive if I had to use the correct terminology. But you will also find aluminium in things like underarm deodorants. Have a look at the antiperspirant that you are using. You will probably need a magnifying glass to be able to read the handwriting or read the printing on there, but have a look and see what the ingredients are in your antiperspirant, specifically the roll-on or the stick, but found also in the spray. Recent studies have shown that gluten can also cause severe nerve damage. A study by Paul Whiteley and Associates found that avoidance of gluten for 5 months resulted in marked improvement in many autistic children. Simple solution. Reintroduction of gluten resulted in the rapid deterioration in behavior. Gluten in wheat, rye, and barley, and casein in dairy can also act as opiates. I found that to be very interesting. And they can affect behavior and become addictive. And on a side note there, addiction is anything can cause an addiction, or you can be addicted to anything. Let me get my terminology correct. Normally when we talk about addiction, we're talking about alcohol, drugs, but you can be addicted to anything. If you regularly drink coffee and quit for 2 days, see what your head tells you. If you have a headache and you can't go without your coffee on a daily basis, you are addicted to it. Same goes with social media and various other things. Jerry Cartzenell found that about 80% of his patients improved when allergens are removed from their diet. While children can be sensitive to many foods, Cartzenell usually begins with a gradual elimination of gluten and dairy from the diet due to the frequency with which he sees benefit. So he's obviously picked up what are the most common things, remove them first, and see the results. Iacona and associates found milk allergy or multiple delayed hypersensitivity reactions were common when intestinal damage was observed. Gastroenterologists often diagnose ileolymphatic hyperplasia in autistic children. This is a condition in which the lymph nodes are swollen at the end of the small intestine, which often results from viral infection or delayed food sensitivity. Dr. Arthur Krigsman has demonstrated with photos that many autistic children have ulcerative sores in the small intestines. Small wonder they can't sleep. They're in pain all the time and even bang their head against the wall or floor. You've seen these pictures where these kids just sit there and they just knock their head continuously against the side of the cot or in the bedroom next to against the wall, and they knock their heads until their head bleeds. Well, you maybe need to check them out a little bit further to see where the problem is. The immune system has two branches. These are known as Th1 and Th2. The Th refers to the fact that the immune cells come from the thymus gland in the chest. The Th2 branch of the immune system produces antibodies to disease. 80% of the immune system is in the gut, which is why it's so imperative that if you have an antibody, or if you take medication, for instance, that can destroy the bacteria in the gut, it's so important to have a probiotic afterwards to rebuild that immune system. Autistic children often demonstrate common gut manifestations of a damaged immune system, including chronic diarrhea or chronic constipation, the opposite, as well as abdominal pain. Another manifestation of a damaged immune system is allergic responses to foods and chemicals. Common indicators of allergic manifestation seen in autistic children include red ears and cheeks, dark circles under the eyes, changes in handwriting, maybe they're practicing to become doctors, changes in pulse rate, and changes in behavior. And a change in pulse rate is often found if a food allergy happens. And one way of testing that is you take your pulse, eat a food that you suspect you might have an allergy to, and take your pulse again afterwards. And you should be able to find out where the issue is. Autoimmune tendencies can be aggravated by deficiencies of vitamin D. The term dysbiosis refers to a disturbance of the bacteria living in the digestive tract. Remember, we've got good bacteria and bad bacteria in the digestive tract. And as I think it's Dr. Ariana Karugi likes to say, there is only so much real estate in your digestive tract. So if you've got more bad bacteria, there's not a lot of space for the good bacteria, which is why it's so essential to get that balance correct. The work of Derek McFabe suggests that bacteria which produce propionic acid may be involved with autism. Autistic children will often develop strong attachments to a limited number of foods high in sugars and carbohydrates. These foods promote the growth of bacteria and fungi, which produce toxic substances in the digestive tract. Chronic constipation can aggravate the problem by promoting the absorption and circulation of these toxic substances throughout the body and brain. The treatment of overgrowth of harmful bacteria and fungi should include removal of the foods which feed the pathogens. Sounds simple. Take away the cause, get the cure, but it's not always that easy. And substances which discourage the harmful organisms and supplementation with beneficial organisms with the ability to crowd out those pathogens. So you've got to get rid of the junk and replace it with good stuff. promotion of normal elimination can provide immense benefit in promoting the elimination of both toxins and harmful organisms. Alleviation of chronic constipation can often be achieved by increasing fiber intake, as well as supplementing with vitamin C and magnesium. Some very simple suggestions over there. Many children are treated with repeated doses of antibiotics for recurrent ear infections and other issues. And I remember growing up, I suffered with middle ear infection, apparently with every tooth that I pushed through. But I remember, obviously I don't remember that part, but later on in life, I do remember anytime I got a cold, my ear would get infected and get hauled off to the doctor and be given antibiotics. Back in those days, we were never issued with probiotics afterwards, but we did have access to fresh milk that wasn't pasteurized, which made a significant difference. So I often wonder how I survived childhood with these things, but we did. Now this predisposes them to the fungal infection. So the repeated antibiotic use makes you more susceptible to fungal infections. And this is compounded by diets high in sugars and soft drinks laden with carbon dioxide. Think fizzy drink or fizzy sodas. Yeast infections can be indicated by laughing during the night and day and itching in the genital and anal area, as well as a yeasty smell to the stool. Constipation and diarrhea are common. So if they don't have one, they've got the other, because you can't really have both at the same time. And these children often suffer with brain fog and can behave as if they are drunk or stoned. They really zoned out look on their face. An organic acid test will usually show elevated levels of arabinose and tartaric acid. Acidophilus and garlic can be effective in suppressing yeast infections. Now, just a suggestion, I would not take both at the same time, because garlic is a very good antibacterial and antifungus. And acidophilus, as we know, is a probiotic. So if you take garlic at the same time, you are going to zero out the effect of the acidophilus. So you need to do your garlic first. I would suggest about a week's supply or a week's course, and then push the acidophilus. Carbonated beverages and sugars should be avoided at all costs. And this goes the same for ADD, ADHD, diabetics, pretty much everybody. Assuming that autism and related disorders are associated with defects in the ability of the body to deal with toxins, it makes sense to eat foods and utilize supplements which will improve the ability to cope with toxins. Probiotics, which are beneficial bacteria, can greatly reduce the quantities of harmful substances produced in the digestive tract by harmful microbes. In order to derive benefit from a probiotic, it must contain beneficial organisms. They must be alive, and they must be able to survive transit through the highly acid stomach contents and the digestive enzymes in the small intestine. This is no simple task. Deficiency of digestive enzymes results in the inability to break down foods, leading to the intolerance and allergic response. Because often an intolerance or allergic response simply is an indication that your body does not have certain proteins and enzymes to break down the food and the bigger proteins. And this results in inflammation in the digestive tract and the release of cytokines, which are immune chemicals which can induce pain, discomfort, and behavioral changes. Enzyme supplements to address this problem are often helpful for autistic children. Reduced digestive competence can cause children to avoid difficult to digest protein foods in favor of sugars and carbohydrates. Tastes better, and it's easier to swallow. Why do you want to battle with all these bigger things? easily digestible protein supplements can be particularly helpful in some of these situations. And this will often be in the form of a protein shake. And one of the shakes that we use has got 3 forms of protein in it. It's got a pre-digested form, which means that your body can instantly absorb it, a semi-digested form, and an undigested form, which is what makes it effective over a longer period of time. The diets of autistic children are often loaded with trans fats and inflammatory omega-6 fats. I'm running out of time over here. Supplementation with quality omega-3 fatty acids from fish and phospholipids can improve brain structure and function, and also reduce the inflammation in the body. Detoxification in the body is achieved through 2 enzyme systems, namely glutathione and methylathione. So methionine. Apologies for the big words. Both of these systems are dependent upon sulfur-containing proteins like cysteine, zinc, and selenium. Proper methylation is also important for the production of glutathione, which is the body's most abundant antioxidant and detoxifier. Methylation requires the B vitamins, including B6, B12, and folate. In other words, taking a vitamin B complex is your best type. A substance called TMG, or trimethylglycine, has also been used with autistic children to promote this methylation. These children often manifest poor methylation and increased oxidative damage, which results from this. Vitamin C and lipoic acid optimize the functioning of glutathione and also promote detoxification in the body. Again, we can see a single vitamin is not going to do the job. It's got to work in conjunction with a lot of other things. And this combination also helps to reduce free radical damage. Other antioxidants include CoQ10, vitamin E, and carotenoids, and they can provide additional benefit by protecting tissue fats in the brain and nerves from oxidative damage. And that is the end of that. I'm going to stop recording